As far back as Hippocrates in 400 BCE, and maybe even further back, the link between air quality, the environment, and health has been recognized. It is clear that indoor air quality is of importance to our health, yet it continues to be relegated to the periphery of policy formulation. The COVID-19 pandemic has thrown the issue into sharp relief once again, yet Europeans continue to spend around 90% of their time indoors, a habit unchanged since pre-pandemic times. So why then does IAQ indoor air quality remain an enigmatic policy matter? What historical factors have contributed to regulatory lapses in this area? And what are the hurdles in gathering the right evidence for the development of effective policies? With that, we are proud to kick off the inaugural webinar of the EDIAQI project, Indoor Air Quality, Always a Bridesmaid, Never a Bride, referring to the fact that indoor air quality tends to be pushed further down the queue when it comes to priorities, particularly in relation to outdoor air quality. Today, joining us for this critical discussion, we have Rita Araujo, Policy Officer at the European Commission's Directorate-General for Research and Innovation. Welcome, Rita. We have Xavier Basagaña, representative of the InChildHealth project, the current ideal cluster coordinators. And finally, we have Mario Lovric, scientific coordinator of the EDIAQI project. And my name is Alex Borge. I'm a research associate and project manager at the Lisbon Council, and I have the honor of moderating this high caliber panel today. Looking at the agenda, we have an action-packed session with a presentation on indoor air quality and EU policy by Rita. Followed by that, an exploration of European research and the ideal cluster by Xavier, and a detailed look at the key advancements in research on IAQ and the EDIAQI project by Mario. The session will then move on to the panel discussion, followed by questions from the audience. Please, if you have any questions at any point, don't hesitate to ask. And without further ado, the floor is yours, Rita.
Thank you very much, Alex, and good morning. And thank you for the invitation to be here today and speak about indoor air quality and EU policies at this webinar organized by the EDIAQI project. If you could move the slide, please. Thank you. So I would like to start by stating some facts that are for sure well known for the environment and health research community, and that illustrate why the quality of the air we breathe indoors is so important for our health and well-being. A recent report published by the European Environmental Agency in 2022, the Zero Pollution Monitoring Assessment report, shows that although progress was made in reducing pollution in Europe, some very worrying figures still persist. And I mention a few here in this slide. According to the report, over 10% of annual premature deaths in the EU member states are related to environmental pollution. Air pollution remains the #1 environmental risk with impacts on human health in Europe. And although outdoor air pollution represents, of course, an important health risk, we spend, as Alex mentioned already, between 85 to 90% of our time indoors. And it is well known that poor indoor air quality can significantly affect our health and well-being. I used two figures in this slide from the EA report to illustrate how serious this issue is. So here on the right side of the slide, you can see that poor air quality can potentially cause multiple health problems. And in the graph below, you can see the results of a study which monitored the air quality in schools across Europe and found in several occasions concentrations of CO2 that were above the recommended guidelines. So I would like to mention again the progress that was made towards achieving pollution targets, but there is still more to be done in the near future so we can get closer to the objective of reducing pollution to levels that are not harmful to human health. If we can move to the next slide, please. Thank you. So the quality of the air we breathe indoors depends on different factors, such as the quality of obviously the quality of the air outdoors, the construction materials and products that we find inside the buildings, and the building quality itself. And there are a number of EU policies and instruments in place or at the moment under discussion that help to address the challenges to achieve good indoor air quality. And in this slide, I list a number of these initiatives. I will, of course, not mention all of them in detail, even because many of these are under the responsibility of other Directorate-Generals of the Commission, as I don't have in-depth knowledge about the details, but I would like to highlight a few, such as the Energy Performance of Buildings Directive, which in its revision introduces indoor environmental quality standards in line with healthy requirements. Also, the renovation wave, tackling also the health-related performance of the EU building stock, the Zero Pollution Action Plan for 2050, which aims to reduce pollution to levels that are not harmful to human health and the environment. And this action plan also addresses healthy indoor environments.
Rita, your microphone has turned off. Just before you finished explaining the Zero Pollution Action Plan.
Okay, sorry. So I was mentioning that the plan addresses healthy indoor environments also. And also, finally, I would like to mention the revision of the ambient air quality directives, which is expected to align EU air quality standards with recommendations from WHO and is currently under agreement by the Council and European Parliament. And then the next slide. Thank you. So this brings us to the role of research and innovation in supporting all this complex policy framework, supporting with knowledge and tools that will help to develop and implement these policies in an evidence-based manner. The EU programs for research and innovation started already 40 years ago, and they've been funding research and innovation activities in many different areas. The current framework program is Horizon Europe. It's running from 2021 to 2027 and counts on a total budget of 95.5 billion euros. It's the largest research and innovation program to date. And environment and health is an important research area that has been gaining more and more attention and visibility in recent years. And this is reflected in this figure here on the left side of the slide that shows the increasing funding allocated to environment and health research across framework programs of research and innovation over the last 20 years. Environment and health research includes several different areas. And the impacts of pollution on health is the area that collectively receives more support when we consider the last two framework programs, so Horizon 2020 and the first 2 years of Horizon Europe. And that is what is shown here in the figure in the right top side of the slide. In the area of pollution, a considerable share of projects are dedicated to air quality specifically. And of course, we need to be aware that also some of the other categories here represented, like urban health or pollution monitoring or chemical safety, might include also some research actions on air quality. And in the right bottom part of the slide, you can find a table with a list of ongoing clusters of projects from the environment and health portfolio. The joint collaborations between projects funded under the same call is an approach highly encouraged in this area of research to increase the policy impact, to amplify the dissemination, to promote scientific synergies and exchanges. And one of these clusters of projects is the IDEAL cluster on indoor air quality and health, where EDIAQI is also a part of this cluster. I will stop here because the next speaker will tell more about the cluster and the interesting activities the projects develop together. So I will give the word then to the next speaker. Thank you.
Thank you so much, Rita, for that really illuminating presentation. Xavier, you're next. The floor is yours.
Thank you. So I'm going to explain the IDEAL cluster in the framework of the European research. So basically, the IDEAL cluster is a group of research projects that have been funded under the same call by the European Commission, in particular destination to living and working in a health promoting environment. And all these research projects focus mainly on indoor pollution including both chemical and microbiological determinants of this pollution. And they all have two main aims. The first one would be to identify the main sources of this pollution, especially in indoor environments. And then to assess the health impacts of this pollution, again focusing on indoor pollution, with a final aim to make some indoor quality standards. There are seven projects in the cluster. And there is 121 partners contributing to that, and here you can see the names of the projects. Yeah, next please. And each one of these projects is very big, and it has it covers a lot of issues, a lot of objectives. So it's very difficult to summarize each project, but I came up here with one or two sentences for each. So Key Health in Air aims to increase the knowledge about chemical and biological indoor pollutants affecting human health. And they also aim to provide solutions for monitoring and improving indoor quality. Then Synergy aims to reveal and quantify, in this case, interactions between different pollutants and how they affect our health. And they focus on the school setting. The LEARN project aims to control and evaluate indoor air quality, again, in schools, and to study their impact in health. And in particular, they are proposing to use novel sensors, advanced biosensors, and novel remediation strategies to improve air quality in schools. Twin Air will develop a technological solution system to improve air quality in different indoor environments. And they will also investigate how the air pollution in indoor space affect our health. Next. Then there is InChildHealth, which will integrate health, environmental, technical, and social sciences to identify which are the determinants of air quality and to evaluate their impacts. Also, this project is focusing on schools. Inquire also aims to provide knowledge and tools and to measure indoor quality, and in this case they focus on the health of children up to 5 years of age, and they will do monitoring in homes. And the EDIAQI project, the ones organizing this webinar, they will study also indoor air pollution in European cities. They will do short-term measurements and also long-term large-scale monitoring with the aim of understanding the sources, routes of exposure, and health effects. So you have already seen that there are many commonalities about the projects, and this makes sense because all of them are trying to answer to the points raised by the funding call. But yeah, the commonalities include the interdisciplinarity of the research. All of them try to come up with a holistic understanding of indoor air quality and its impacts. All the projects use advanced monitoring systems, and this means developing new systems and implementing them. Also, all the projects assess the impact on health through rigorous research, exploring real-life scenarios, and also focusing on vulnerable groups. Again, all the projects aim to find solutions and interventions to improve indoor air quality. All the projects have a strong involvement of stakeholders, and also they implement new technological advances like artificial intelligence or other technologies. So we have created in the cluster different working groups to make sure that the different projects collaborate and to try to maximize the final impact of these projects. Next. with the final aim that we want to implement the findings of all these projects and make recommendations to create healthier, more sustainable and inclusive living spaces for everyone. And this is in a very short time frame what the projects in the IDEO cluster would do.
Xavier, thank you for that really enlightening and detailed look at the ideal cluster, and for being short and sweet. We very much appreciate it. Mario, could you kindly take the floor now? The floor is yours.
Thank you, Alex. Mario Lovric here. I'm the scientific director of the EDIAQI project, and yeah, let's move on. So the EDIAQI project is one of the 7, as listed previously within the ideal cluster, and our project is very much focused on being out there in the field and trying to gather as much data as we can. So we have 4 pilots and 4 campaigns within this project. You can see on the map there that we are spread all across Europe, but these are not the only countries we have in our projects. We are in total 11 countries with 18 partners, and we have all sorts of indoor spaces we're evaluating here. So going from general kind of office or workplace buildings. We have a household pilot in Croatia. We have public spaces like cinemas, schools, hospitals, but we're also evaluating the metro in Spain. So you can see there is a strong diversity regarding where we are measuring. So this is packed in total in 4 pilots and 4 campaigns. And we want to create kind of more understanding on indoor air pollution and sources, to understand health associations. And in our project, it's based on children's asthma and allergies. Besides that, we're also doing a lot of toxicology, so in vivo and in vitro models, but sorry, experiments, but models as well. And we have a lot of human biomonitoring as well. So can you go back? Sorry. No. Big focus in this project is based on low-cost sensorics. So you can't measure it all. Measurement methods are very expensive. This is why we, but also the other projects, are focusing on implementing low-cost sensorics to get as much data as we can. Next one. It's been 1.5 years since this project started, but we are already equipping many buildings and spaces with sensors. So we have a diverse typology of buildings. So we have schools, kindergartens, offices. We have residential buildings as well. And like I said, we also have a metro. We have already equipped 45 out of planned 66 buildings with sensorics and measurements. And there we have more than 119 installed sensors at this moment. You can see from the charts that we have, we're following the buildings intensely. So Ferrara, Estonia, Vilnius in Lithuania, Seville in Spain. We're following these buildings. We're installing new sensors on a weekly basis, and we're trying to get them in our data platform. Besides that, we have our own prospective childhood cohort in Zagreb in Croatia, and we have been recruiting patients intensely. At this moment, there are around 140 patients in the cohort. So we need kind of 60-ish to achieve our goal of 200. Those are childhood patients. And we are evaluating not only their clinical records, but also everything inside and outside of their homes. And could you go to the next one? The dynamic situation they have indoors. So the children's rooms are equipped with sensors. So we have 3 sensors providers in our projects, and we're trying to follow as many pollutants as we can. Among those are particulate matter, NO2, VOCs. We have a sampling of microplastics and PAHs as well. Besides that, we're conducting biomonitoring on the children. So we have our biologists taking their buccal swabs and blood samples to analyze potential DNA damage on that. Furthermore, we're also doing a lot on the microbiome. So it's important topic in indoor spaces, because your microbiome indoors can shape your health as well. So our promise regarding this call is to deliver as much data as we can. So what we expect within our project is to understand indoor concentrations of all those mentioned pollutants like PAHs, VOCs, particulate matter. In a smaller scale, black carbon microplastics and the microbiome within the residential part. But we also want to report potential associations regarding childhood asthma and allergies. Besides that, we are very active on the awareness and perception part. So we want people to understand what this is all about and how important indoor air quality is. We hope with that to create accessible knowledge for the EU citizens. Hence, we already created the so-called EDIAQI wiki, where one can find the relevant information from the project and in general regarding indoor air quality. And we're working on an indoor air quality simulator so that one could try to assess their own indoor air quality once the project is done.
So thank you very much for that, Mario. And now we get to move on to my favorite part, which is the panel discussion. And Rita, the first question is going to be for you. What are the most significant challenges in regulating indoor air quality compared to outdoor air quality?
Thank you, Alex. Well, I will try to. That is a difficult question, but I will try to answer to that. So while for outdoor air, overarching legislation is in place at the EU and national level and provides binding guidance, this is still missing for indoor air. So it's not covered at EU level, because traditionally design and in particular occupant behavior differ significantly. Thus, it's more sensible to regulate this at the national and regional level, but there is still a lot to be done at the national and regional level. So in most member states, definitions on indoor air quality remain weak, and several important topics still need to be tackled, like, for example, on emissions from the furniture and technical equipment. These aspects are not sufficiently covered yet. So those would be the main aspects that I would mention.
No, I think they're very important, and it really speaks to the historical regulatory lapses. I'm going to push on then to Xavier here, and going in line with this sort of questioning. How does the complexity of indoor pollutants and sources hinder the understanding of the health implications associated with indoor air quality?
Yeah, it makes it a lot more complex to study indoor indoor pollution effects. Well, mainly because it's much harder to measure everything. I mean, it's already complicated for outdoor pollution, but once we go into the indoor space that already has a lot of penetration of the pollution from the outdoors, so also that needs to be taken into account. We have other sources indoors, from gas cooking, from the mere presence of humans, or pollutants from materials. or paint. And then there are other things that are very relevant for us indoors, like microbes, allergens, and chemicals. And it's actually the combination of all these chemicals with the lack of ventilation in the closed space, which makes it a lot more complex to study what are really the health effects and which are the specific pollutants that contribute to that, or the mixtures of pollutants that can drive some of the health effects.
No, that's very important. I'm really seeing here from kind of what Rita said, right, that there's different behaviors and there's kind of diversity, but there's also so many different kinds of pollutant sources, right? So I'm going to bring back the question now to Mario again, but slightly different there. What are the main challenges in regulating indoor air quality compared to outdoor air quality in your view? And within that, what are the objectives of the EDIAQI project in that context?
Yeah, so I would say, you know, for outdoor air quality, you're mostly trying to handle the sources, or the pollution creators, so to say. With indoor, it's you have different aspects of this. So for once, it's the legal aspect. So you can regulate public buildings, you can regulate you know, office spaces, for example, but then it largely depends on which type of use you have there. So it's not every office is the same, not every type of occupation is the same. Then you have the issue of you know, indoor. It's mostly people spending their time at their homes. How can you regulate that? You know, pollutants come from occupants, from habits, etc. This is very hard to regulate. And then you have the whole issue, for example, what we have here in Zagreb, but I guess in many other European cities as well, having historical buildings which are protected, you know, by architects, etc. And you can't do any changes without, you know, getting the permissions. And the whole thing with lifestyle and with habits, you know, a lot of pollution comes from cooking and heating. How can you regulate that with people? So you can do it in public spaces, but you can't do it at homes. And then there is the whole issue of what do you track? So you know, using low-cost sensorics, given the good quality, we can easily track, you know, CO2, particulate matter, etc. But microbiome, biological pollutants, this is not easy to track. So it's expensive. You need a lot of work there. We're using genetic sequencing, and yeah, I think this will be difficult to regulate.
No, it's very
Sorry, I should mention just, sorry, on the EDIAQI project. So our objectives are based on the idea of creating evidence as much as we can. So we want to create data not only to process and work with it for the duration of the project, but also a lot of data to stay there and be processed by other scientists in the future.
We're building the baselines, maybe in
Building
some
the
senses.
baselines, yeah. But I also think the other ideal cluster projects have a very same goal.
And we're actually, that's a very good point you've made there, because we're going to get onto that now. And I think this gets to a crux of a lot of the participants here today I know are from the Ideal Cluster. So Rita, how are the research results from the Ideal Cluster projects expected to feed into EU policy on health and the environment?
Well, as was presented before by Xavier, these projects collectively cover a wide range of indoor air pollutants in a variety of living and working environments, population groups, and geographical areas, and focus on diversity also of health outcomes. Many of the projects are also developing technologies, sensors to increase the capacity of monitoring indoor air quality, and will produce at the end of the project recommendations and guidelines based on their findings. So these projects bring together an incredible and important amount of scientific and technical expertise and also capacity. There are 25 countries involved in this cluster with more than 100 research organizations. So, and as I mentioned in one of my slides, there are several EU policies and initiatives in place that cover different aspects that are tackled by the different projects, and that we expect that will greatly benefit from the knowledge that will be collected by these projects, and also the tools that they will be developing.
I have to say, one of the things that I have noticed is the real collaborative spirit in the IDEAL cluster, and the fact of the geographical diversity. So I'm very happy that you pointed that out as well. So we move on now to Xavier, rather. What are the biggest unknowns in the relationship between indoor air quality and human health?
Well, there are many. One is what I was mentioning before. Really, what are the effects of these mixtures of pollutants that occur in the indoor environment, and how can they be toxic for us? There is also, and now we have seen it with the COVID pandemic. Now there is a strong interest in knowing how indoor air quality influences the transmission of infectious diseases, and more especially what are the actions that we can do to prevent or minimize these transmissions of infectious diseases. But also there is now a lot of research on the cognitive effects of exposure to air pollution. And here, well, for many years, we know that when there are high levels of CO2, no indicating that ventilation, we have more difficulties in concentrating and so on. But this actually may not be due to CO2 or only to CO2, but it may be just the accumulation of other chemicals, particles, or other pollutants that actually have been proven to be neurotoxic, like box or flame retardants. Knowing which one of those are involved in the cognitive effects, and understanding better the biological mechanisms of all these actions, it's really, there is a lot of work to do on that.
Lots of work ahead for us, and I'll push us on then to Mario. I ask you maybe to keep it a little on the shorter end, so we move on, because we have a lot of questions in the chat and a lot to discuss.
Yeah, so I mean, we have 7 projects, so I guess we'll gather a lot of information to answer the knowledge gaps given in the call. Comparing to other projects, I would say we may be a bit more focused on the chemistry in households. Besides, doing many office buildings, public spaces with sensorics, etc., we have a lot of chemistry going on, and I think it will be very interesting having all those biological and chemical information at the same time for those households to see whether there are any relationships. Besides that, we have the very strong cohorts, so we hope to understand not only clinical associations to pollution, but also to go deeper into biological pathways, since we have metabolomic, microbiome data, etc. I think these are our strong points.
I realized I forgot to ask the question there, but thank you for answering it. And it's very illuminating to see how the EDIAQI project fits in within this ecosystem of projects. And it's been a very interesting conversation. Now the conversation continues. We have a lot of questions in the audience, I think more than 10. I think we'll start off with the first question, which is for everyone. I asked you to keep it as short and sweet as possible. And we'll obviously go from Rita, then to Xavier, and then to Mario. how can we find the balance between the data protection policies in the EU and the need to gather as much indoor, and brackets, and dweller data to be able to create policies on indoor air? And Rita, please go ahead. You're first.
Well, it's really difficult because we understand from our exchanges with research projects that are working on collecting this kind of data that is really challenging at the moment to deal with the requirements of GDPR and how to collect the needed data and assure the right protection of the data also, and so yeah, I think it's something that we need to be adapting to the feedback from our side. That's what we feel, that we need to be adapting to the feedback we receive and see how we can find ways to still keep the privacy of data while we facilitate the collection, the needed collection of data and sharing of data that could advance the knowledge in this area.
And what do you think, Xavier?
Yeah, no, it's a complex, issue, but I really think we have to take this the privacy issue seriously. Really, the studies that we're conducting, we are, and we should continue. We should continue like that. I think we can do a lot of work with volunteers, and we're very happy that many volunteers want to participate in our studies and share their data. But at the same time, we as researchers should be very careful on protecting the privacy of this data.
Maybe to frame it in the context of the EDIAQI project for you, Mario, what are your considerations on this?
Yeah, so this has been a big issue because I remember from early in the project there were questions like, okay, you want my DNA, what will you do with it? Especially given the whole COVID crisis and the skepticism against the vaccine, etc. So there was a lot of skepticism with the participants in the studies as well. Coming from data science, I see it kind of on different levels. So we definitely won't upload kind of private or personal data to the databases. So we're doing on multiple levels. We have within the project what we can analyze and how deep we can go regarding the data, and then a level of anonymized or aggregated data can go further. So I would say it's an iterative process, and also trying to share it given the different levels of access.
No, I think it's very good contextualizing the EDIAQI project. I'm going to move to the next question, which will be for Rita. Rita, what can be expected from EU research and innovation programs regarding indoor air quality in the coming months and years?
Well, that question is very timely as we are working now on the work program 25. As I mentioned, the current framework program for research and innovation, which is Horizon Europe, runs until 2027. There was a call in 2024 published and is now closed that addresses the impacts of air pollution on non-communicable diseases, and there air pollution is under the scope of the call. Another important information to retain is that the strategic plan for the last 3 years of Horizon Europe was published recently, and this plan sets the strategic orientations for this period. And there, the triple planetary crisis, which concerns pollution, biodiversity, and climate change, is mentioned as one of the big challenges to be addressed by research. And this week, on Monday, was launched a feedback opportunity for the Horizon Europe Work Program of 2025. So everybody interested has the opportunity to comment on the orientations of the different clusters, and this includes cluster health. There is a survey, and Destination 2, which is living and working on health promoting environments, mentions the importance of research on air quality and the impacts on health. And the consultation is open until 6th of May. And the responses of the consultation will support the drafting of 2025 topics. I cannot say that indoor air quality will be addressed in calls in the coming work programs, but definitely air pollution is one very important area in the environment and health research portfolio, and this for sure will be reflected in strategic planning of future work programs.
There's another question from which really follows up from this, Rita, from Paginotis. Do excuse me if I'm mispronouncing your name there. I know he's a member of the Ideal cluster as well, because we're working together on the policy. So I know this is a very important question from him. What is the progress of the actions identified in the Zero Pollution Action Plan regarding indoor air quality? And apart from participating in relevant projects, is there any further ways that civil society could support this important work?
Well, the progress of the Zero Pollution Action Plan is periodically evaluated by the publication of one of the reports I mentioned, that is the Zero Pollution Monitoring Assessment, and also at the same time, the Zero Pollution Outlook report that is published by the JRC. These reports were published in 2022, and in the 2022 assessment, indoor air quality was just a very small chapter. Most of the findings related to air quality were related to outdoor air quality. Now there is a new, there are these new reports, a new edition of these two reports is being prepared to the end of 2024. And there will be a new assessment that I honestly am not aware of the specific content of the assessment, but given the revision of the directives, I expect that something more substantial will be done in relation to indoor air quality. And in relation to the civil society, well, I think there is really a big role in terms of dissemination campaigns and awareness campaigns on how to improve indoor air quality in buildings and homes and spaces that everybody uses.
Thank you for that illuminating answer there, Rita. I'm going to move on to Xavier now. Xavier, is there a project in the Ideal cluster sampling for oxidative potential of PM?
Yeah, well, I actually don't know the answer to for all the projects. I know that in InChildHealth it is not one of the main parameters that we measure, and I'm not sure if any of the other projects are measuring it. And sorry, because this is not really my my main area. So maybe for the EDIAQI project,
I can only comment that we have been discussing this to try it, but as far as I understood it, it needs high volume samplers. They're very big, very noisy, and we have people already complaining with a 1-day session of collecting samples, so it's a bit difficult to implement this.
Thank you. Mario, I'm going to ask you one more question here. Are there sensors mainly chemical I'm assuming this is in the EDIAQI project, right? So are the sensors we're using mainly chemical? Do you also monitor microbiological parameters here? Only swabs from the children or only swabs from the children?
Okay, so regarding sensors, we have in the EDIAQI project, we have 3 producers, yeah, I think they're all also commercial producers. So maybe there's more information available online. And I think in these housings there are all sorts of sensors installed and a lot of electronics. I think some of those are electrochemical. But yeah, I think the websites could reveal more. Regarding the biological determinants, so we have biomonitoring, which we kind of packed in with the clinical information as well. So buccal swabs, micronuclei, comet assays. This is what we called kind of the biomonitoring part. But we're also evaluating the house dust or bed dust microbiome. So we're trying to understand understand the bacteria which you have in your dust at home. And as I mentioned, this is done by next generation sequencing. And as far as I know, in at least 4 projects in the IDEAL cluster, this has also been done.
I'm looking at the time, and I've promised that we can go over this by an extra 3 or 4 minutes, if that's okay. And I'm going to ask, we have so many questions, so we're not going to be able to get to all of them, unfortunately, but I promise we will give you back an answer via email. But I'm going to move on to this question, which I think is a very important one, which is how much does it cost us in terms of the economy, in terms of health per year, because we don't have healthy indoor air? And is there any work by economists or something similar of the sort such data can help us politicians to bring forward indoor air within the federal parliament? That's for everyone, by the way. So I will go, I should have said that. Rita first, then Xavier, and then Mario. Forgive me.
Well, I don't have an answer to, I don't know in concretely how much it costs. And I hope my colleagues from the panel can be more useful to answer to this question.
Xavier, do you know?
No, I don't know of a particular study that has examined this. Well, we know from in other parts of the world, indoor pollution is especially when burning inside the homes. No? And there have been calculations for that, but I don't know any study for Europe, and probably if there is one, it will be simplifying things a lot because of the things that we have commented. It's very difficult to characterize all the different kinds of indoor spaces, and we don't know enough yet to make accurate quantifications. Maybe there are some, but I imagine that if they exist, they will be based on very simplifying assumptions.
Mario, do you know of any by any chance?
I'm not sure if something like this exists, but I guess this is indeed one of the points of these projects to get enough data, to get enough evidence to create either models or estimations, because right now we don't have it. We have several studies. When you look up papers, there are some nice studies from UK, etc., but other countries too. So this is what these projects will do. We will create the evidence and gather the data, and then, if not us, someone else will be able to model such things.
I'm going to ask 2 more questions, but I'm going to combine them together in the interest of time. And please be short and sweet, panelists. Are there already examples of countries or cities, just 2 of the top ones that come to you, please, which are already advanced in improving indoor air for their citizens? And I think this one's just really for Rita, and I know you might not be able to answer it, but are there any plans to standardize indoor air quality for the EU member states on like an EU-wide scale? So let's start with the examples of countries, if you know any good examples, and then we'll move to that last one for Rita. So Rita, go ahead.
Well, again, I don't know about concrete examples of countries that are doing this. Maybe Xavier and Mario have some examples. In relation to the standardization efforts with countries, as I mentioned before, the EU is not regulating on indoor air quality, so we put forward a number of initiatives that might help member states and at regional level to increase the indoor air quality, but we don't standardize or we don't regulate at the EU level on this aspect.
Xavier?
Yeah, no, sorry, I'm not able to pinpoint any particular city or country.
Someone wrote in the chat that Belgium is active on that. So maybe this is the answer we're looking for.
We maybe have to do some research now afterwards. I'm quite curious to find out
I
this.
think I haven't expected such a big discussion. I'm very happy with this, and I think we can take these questions and think further about it.
I'm going to give you one last chance for one last word each, if you want to have anything to round off this webinar, and then we'll just do some closing at the end. Thank you so much for staying on as well and for joining us. So please, one last word from each of you.
Well, I can say that these discussions were really interesting and really highlighted the big challenges related to improving indoor air quality. And yeah, I think it's a lot of food for thought and lots of things to be done in the near future.
Xavier?
Yeah, no, I think also we have been talking a lot about regulation, but I think it's not only about regulation, it's also about information, and that people is aware that there are some indoor sources of pollution that are not good for health, and that there can be ways to avoid that or to improve that. So yeah, regulation is not the only way, and there can be other actions to improve indoor air quality, and as a result of that, to improve our health.
And Mario?
Yeah, I'm happy about the interest here. So I think I haven't expected this many participants in our webinar, and I think this will make us drive things further. Try to look for the answers. Try to combine more information, and yeah, looking forward to the next one we plan to have.
With that, I want to firstly thank all of the panelists for your time, for your insightful contributions, and for really delving into some of these big issues surrounding IAQ, indoor air quality. I want to say thank you to all of you for your active participation and contributions in today's webinar. This marks not the end, but rather just the beginning in our ongoing discussion on this crucial topic. Keep an eye out for our upcoming webinars. The next one is scheduled for June. We don't have a date yet, but it's scheduled for June. And we promise it will be just as engaging. We encourage you to become a part of our vibrant community by joining the EDIAQI project. And so I'm going to leave this for 1 second. Okay, now's your last chance. And the ideal cluster projects. I just realized, sorry, 1 moment. And the ideal cluster projects. For the seamless updates and information, please scan the QR codes displayed to follow our LinkedIn pages and to explore the websites of the EDIAQI project and the ideal cluster. There we go. I'm leaving that for 5 seconds. Okay, please make sure you have out your phones. Okay. And one last thing, we extend our heartfelt gratitude to our panelists once again for their invaluable perspectives, to you, our audience, for the engaging discussions that brought this event to life. And with that, we conclude today's session. Until next time, stay connected and informed. Thank you and goodbye. Ciao, everyone.